Has anyone ever told you you overpronate when you walk or run? Perhaps you heard this from a coach, a friend, or a family member. Maybe you've already suffered foot and ankle problems resulting from this condition. Today, I'll tell you what overpronation is, what causes it, how it can negatively affect your feet and body, and how it's treated. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook about one of the consequences of overpronation called Stop Living with Stubborn Heel Pain. You can download it in the description below. If you find this information helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. I'll start by explaining what overpronation is. First, when we walk or run, we all pronate. The arch goes down as your hips go in. It's a natural part of moving. It's the inward rolling movement of the foot as it propels forward. It helps us to absorb shock and maintain our balance. When our feet roll in too much, that's overpronation. The arch of our foot really flattens out more than it should, putting a lot of stress on our muscles and tendons and ligaments in our feet and in our legs. That's why people who walk or run frequently are more prone to having foot and ankle and other physical problems like knee, hip, and even low back pain. So what causes overpronation? The most common cause of overpronation is having low arches or flat feet in the first place. When you have this foot type, you naturally roll your feet inward more than those with higher arches. But there are other causes too. Another very common problem is a tight calf muscle. When your calf muscles are too tight in the back, it limits the ankle motion and forces your foot to overpronate as you try to go forward. Gaining weight can increase the pressure on your feet, making overpronation worse. For example, it's not uncommon for pregnant women to experience foot pain due to increased overpronation. Hormonal changes can add to the problem by causing the feet to flatten out more and elongate, requiring longer shoes. Our medical conditions such as posterior tibial tendon dysfunction or Charcot foot can also cause or make overpronation worse. Finally, wearing improper footwear during high-impact activities can make overpronation worse. So how do you know if you overpronate? At the office, we'll watch you walk, check your shoes for uneven wear. We'll also have a gait analyzer that will show us visually how you walk and where the pressures fall. You can also do a simple test at home to identify your foot type. Wet your foot and step onto a piece of paper. Compare your footprint to the chart that I've provided above. If you have flat feet, you're likely an overpronator. You can also inspect the bottom of your shoes for wear patterns. Overpronators will wear down the inside of their soles more than other people. Also, if you've experienced any one of the following conditions, you likely overpronate. First, plantar fasciitis and Achilles tendonitis. Overpronation is a common cause of these conditions because they add more strain to the plantar fascia as the arch collapses and cause the calf muscle to overwork and develop Achilles tendon problems. Overpronation can also cause the big toe to move toward the little toe, causing bunions and hammertoes to occur over time. Finally, overpronation doesn't just affect the feet, but many other structures above the feet, including the ankles, shins, knees, hips, and low back. The constant inner rotation from the excessive pronation is involved, and most often pain can occur, but even stress fractures in the shins can occur in the front of your leg. Athletes with overpronation are at increased risk to repetitive motion and higher impact activities. Getting treatment is essential to prevent this condition from causing injury and chronic issues. Fortunately, it's not hard to treat overpronation. The goal is to prevent your feet from rolling inward as much as possible when you're active. When you come into the office, I'll take various factors into account when coming up with a plan to treat it for your level of activity, lifestyle, and severity of the condition. This information will help me determine what type of devices you need. Prescriptive orthotics or over-the-counter arch supports may be necessary. In the milder cases, the over-the-counter supports can work, but with moderate to severe overpronation will require custom orthotics. These devices are designed specifically for your foot to provide optimal support and realign your foot bones as you walk. When you first come into the office, I'll tape your feet to reduce the pain to help me identify additional treatment options and just what kind of battle it's going to be to fight with your feet. You can even tape your feet at home using a product called Quick Tape. I'll put a link in the description below. If I diagnose you with posterior tibial tendonitis, I'll provide you with a special brace to improve alignment and reduce strain on the foot and the ankle. Because tight calf muscles can worsen overpronation, I'll give you stretching and strengthening exercises to reduce the effects of this problem. In addition to wall stretches, I'll advise you to use an Achilles splint to allow you to stretch more effectively when you're sitting and watching a program. Strengthening exercises can also help you build arch support naturally. Towel curls are one method to help with this. Buying shoes designed for your sport that provide adequate support and motion control are critical and in treating overpronation. I'll put a link to a video to help you buy the best shoes. Unfortunately, a few conditions caused by overpronation can lead to foot conditions that may require surgery, such as advanced bunions, hammertoes, or posterior tibial tendonitis. We always try to treat these conditions conservatively first. Taking steps to prevent pronation from taking its toll on the body is key. Many of the treatments to stop overpronation are essential in preventing the conditions I spoke about earlier. If you have flat feet or overpronate, you can do several things on your own. But if you do experience pain, be sure to see a podiatrist. First, you should buy over-the-counter inserts such as Ready Orthotics or Power Steps to replace the inserts that come with your shoes. These will provide greater support. If you've been told you have tight calf muscles, follow the stretching protocol I discussed earlier. Maintain a healthy weight to minimize stress on your feet. Even pediatric patients can benefit from treatment for flat feet and overpronation. If you already have custom orthotics, be sure to wear them consistently and make sure you have them replaced at approximately 5 years. Overpronation doesn't have to disrupt your life. With the right treatment plan and preventive care, you can reduce discomfort, restore alignment, and get back to moving comfortably and confidently in the activities that you love to do.